Hello and welcome back to video 3 in this series of videos about rotator cuff related shoulder pain. In this video we'll be talking about exercise and the benefits of exercise, and I'll be showing you some exercises you can perform to help get your shoulder on the road to recovery. So what are the recommendations in relation to activity and exercise? Well, the World Health Organization guidelines suggest that adults should aim to complete at least 150 minutes of moderate intensity exercise per week. This should often be in bouts of at least 10 minutes or more. One view is often to look at it as 5 days a week doing 30 minutes activity. You can also break this activity down into 75 minutes of vigorous intensity exercise, or a combination of both moderate and vigorous intensity. What is moderate intensity exercise? Moderate intensity exercise is that which is challenging enough to get your heart rate up a little bit, get you breathing a little bit harder. You should still be able to hold a conversation, but you might find you need to take breaths where you didn't need to in your sentences. Whereas vigorous intensity exercise is often a lot more challenging. You will find your heart rate will go much higher and you may struggle to hold a full conversation. You can almost think of this as when someone's running a bit harder. Adults should also aim to undertake physical activity to improve their muscle strength on at least 2 days per week. This is generally resistance exercises. And these don't have to be done in a gym. You don't have to attend any fancy facilities to do it. It can just be doing simple activities such as squats or lifting weights such as bags of sugar or tins of beans, but in a way that you're challenging your muscles. And all adults should minimize the amount of time spent sitting or spent sedentary for extended periods, as this has been shown to be associated with increased risk of such as reducing body fat, maintaining your mobility, improving your memory, your coordination. It can also help to improve your mood, boost your immune system, and reduce risk of other developing illnesses, as you can see by this chart here. So, what is the role of exercise and exercise therapy in shoulder pain? The aim of exercise in shoulder pain is to improve the function of your shoulder and to reduce your pain. This process can take 6 to 12 weeks to start seeing the benefits, and often it requires you to carry it on beyond this point as well. We'd hope that your movement would begin to improve with time, and this improvement may be very small to begin with. You may experience some pain or discomfort in response to the exercise, and this is a normal response. If your pain settles within 30 minutes, that's perfectly okay, and we'd be happy for you to continue with that. If it's lasting longer, it's not a sign that you're causing yourself any harm, but it's just an indicator that you've probably overdone the activity a little bit, and we'd probably at that point suggest adapting what you're doing or changing how you're doing it. But most importantly, quality of the exercise and the consistency of doing the exercise is key. Building the exercises into your daily routine to ensure you get the most out of them. If this is a challenge, it might be worth starting with less exercises just to get you in the routine of it, and then adding additional exercises as you feel able. As if you aren't performing the exercises regularly and consistently with appropriate quality of the exercise movement, then you probably aren't going to get as much benefit out of them. So I'm going to show you some exercises that you can do to get your shoulder on the road to recovery. With each of these exercises, I will demonstrate myself how to do it, and then you're welcome to try them. I will explain how often to do them and what we're trying to achieve with them. So the first exercise I'm going to show you is called a wall slide. With this one, you're going to get a towel, just a small item, a bin bag, or something slippy that you can place over your hands. Some people have used socks in the past. With this exercise, what you're going to do is you're going to get your towel or your bin bag, you're going to place it between your hands and you're going to hold on to it. As you do this, you're going to place your arms onto the wall, and you're then going to use your better arm to slide your painful shoulder up the wall. As you do this, you will slide your body closer to the wall. You will then return to the start position. You will do this 10 times, so up and down 10 times. You will then have 1 minute rest. You will then repeat this another 10 times. You will have another 1 minute rest, and you'll repeat it another 10 times. And that will be the first exercise. The second exercise is a wall press up. So for this exercise, what you're going to do is you're going to position yourself next to the wall, about shoulder width away from the wall. You're going to place both your hands onto the wall and you're going to rotate them outwards slightly. You're then going to lower your body down towards the wall and push back up. You will do this 10 times. You will then have a rest for 1 minute. You will then repeat it another 10 times. You will then have another rest for 1 minute, and finally you will repeat it another 10 times. So you would have done 30 in total. The final exercise that we are going to get you to do, you're going to sit down for this one. What you will do with this one is you will position your arm on an arm of a chair or on a table so that your elbow is supported. With your elbow supported, you will start without any weight in your hand. You will keep your upper arm where it is and you will rotate your forearm down. Your elbow will stay fixed in the same position. This will be a slow movement. You will go up and down 10 times. You will then have a 1 minute rest, repeat it another 10 times, have another 1 minute rest, and then repeat it another 10 times. That will then be the exercises complete. You will aim to complete these exercises 4 to 6 times per week. And it is important to have that rest day as well. Even if you are doing it 6 days a week, it is still important to have that rest day at least once. Some people find an exercise diary can be beneficial in allowing them to keep track of what they've been doing. If you find that doing it this many times is too much, you may start by doing a slightly lower number initially and gradually increase it as you feel able to. And with the final exercise that I demonstrated, if you find that easy, you can add a light weight, maybe a tin of beans or a small bottle of water initially. As I mentioned previously, activity and exercise is not only beneficial for your shoulder, but it is also beneficial for your general health. One of the ways we can support you in this is with an active health referral as part of the active health scheme. This is a scheme that we can utilise to help you achieve your target of getting more active, whether that be through attending the gym, swimming or class-based exercise. What this scheme does is it allows us to refer you to the local leisure centres for their support and guidance in achieving your goals. This comes with a slightly discounted rate to their usual memberships. If you're interested, let one of your physiotherapists know and they will happily refer you. The idea of this scheme is it gives you a way of completing your rehab but also your general fitness in a safe, secure environment with the support if needed. These are some additional resources and references that you can use to get some additional information. The ones that are definitely worth watching, and I would recommend watching, are the Explain Pain videos by Lorimer Moseley. These can be located by searching YouTube for them or following this link here. And the Jeremy Lewis video. These are quite nice videos for explaining what might be going on and helping you understand what's going on. These are some additional resources you can look at. If you're interested in looking more at the activity guidelines, they're obviously located here. And again, another video by Lorimer Moseley, which I'd highly recommend watching if you have a few minutes to spare. Thank you for joining me for video 3, and thank you for joining me through all 3 of these videos in this series on rotator cuff related shoulder pain. I hope it's been useful in helping you understand what's going on in your shoulder and what you can do to get started on the road to recovery. Hopefully alongside the support of your physiotherapist or through general activity and building yourself up.